Hello, good morning, and welcome back to the channel. It's always beautiful to have you here. Today, we'll continue our discourse in science. For today, we are going to be looking at the antibiotic susceptibility test. Now, this is an important test, and there's reason for us to study it and understand it and know how to carry out these procedures. Now, many times in life sciences and microbiology in particular, we have antibiotics that we work with, and we many a times want to check the efficacy. We want to know how effective these antibiotics are against pathogens of interest. And these kind of tests are also ordered for in the hospital because in this day and age of antimicrobial resistance, it is sometimes really important to be able to know if an antibiotic is has efficacy or is effective against a particular pathogen or it's a waste of time. And so we have a test which is called the Kibibauer's method, the Kibibauer disk diffusion method. Now, it's a method that is used to test for the potency of antibiotics, and it works by using discs that have been impregnated with antibiotics at different concentration, antibiotics at different doses, 30 milligram, 20 milligram, based on manufacturer's instruction and then based on the manufacturer of the disc. So these discs have been impregnated with antibiotics. And then the pathogens of interest are grown in petri dishes with Muller-Hilton's agar. And when they are grown, these discs are put on the petri dishes and then they're incubated for about 24 hours. And then the results can be read and you know how effective an antibiotic is or is not. Now it's a very important test, and it's a test that helps one to be able to determine all of these things. And so this is important for us to know. It's also important to realize that there are bodies that are charged or who have worked at standardizing this test. So there's the CSLI Institute, that's the Clinical and Laboratory Standard Institute. We also have UCAST, which are bodies that have worked to standardize this test, this process. So in the standardizing of this process, you have about three what will I call them now? You have your antibiotic can either be resistant, it can be in the intermediate phase, or it can be sensitive. So if the pathogen is resistant to your antibiotic, it means that your antibiotic is not effective. And so you see people with infections, if you have cough or something, you continue to take this antibiotic and it doesn't work for it. It's because the pathogen of interest is resistant to that antibiotic. Now you see it could be intermediate, that is, is neither here nor there, or it could plainly be sensitive. And if your antibiotic is sensitive to your pathogen of interest, it means that it has the ability to clear that pathogen. So these are important parameters that we use, and like I said before, if you look at the parameters, if you look at the way the test is done, you have your Muller-Hilton's agar, you have your pure culture test organisms, you have your sterile swabs, you have your antibiotics impregnated disc. You now have your zero point 0.5 McFarland standard for inoculum adjustment. Then you have your incubator, and then you have your ruler or calipers for measuring. Now, the McFarland zero point 0.5 McFarland standard is important. It's important because it's a test for turbidity. You want to be able to know the number of cells, the number of bacterial cells that you are inoculating onto your agar surface. So to know this, you usually measure your pure culture of your isolates against a McFarland standard. And what you are measuring is you're using an eye test to look at the turbidity. So once the turbidity seems they seem to match, then you believe that yes, you can now inoculate out of your pure culture onto your disk. So it's a simple test and it's run all the time. And it's important to know that the test procedure is simple. You prepared your media. When you prepare your media, you inoculate your media. That's your Muller-Hilton's agar. You inoculate with your pathogen of interest. Then you put your disc. These discs have been impregnated with different antibiotics, and then you cover. And then remember, I said before you inoculate, you check against your zero point 0.5 McFarland standard, and then you inoculate. After inoculating, you incubate for 24 hours. After incubating, you come and read. And how do you read? You read using zone of clearance. If the antibiotic is effective, it will have created a large zone of clearance. You will see that the antibiotic has eaten through the growth of the organism. But if the antibiotic is not effective, you see that the organism will be growing all over the antibiotic. So this is important to know. This helps us to understand. And when this is done, then you read. And after reading, you use your ruler and measure those zones of clearance. After measuring it, then you need to go back to your CLSI standard, which can be the 2024 or 2022, any of the recent standards that you have. And then you measure, and then you see, you check it based on the standards of the CLSI. You can see that, okay, this antibiotic is resistant, is intermediate, or is sensitive. So this is very important and is a test that we're encouraged to understand how it is done and how we do it. So thank you for listening to this. Please remember to like and share antibiotic susceptibility test. And then we talked about the Kibibawa disc diffusion method. Do have a wonderful day.